So my study is about a randomized control trial examining the effect of Qigong, which is a mind-body exercise on frailty of older cancer survivors. The study was conducted in Hong Kong, and we compare the effect of Qigong against an active control group, which is light flexibility exercise, for improving frailty of the older cancer patients. So it was a randomized control assessor blind trial in which the older cancer survivors were screened, who were screened as pre-frail or frail, were recruited, and we randomized them into either a 16-week Qigong intervention or an active control condition, which is light flexibility exercise. And the group sessions and for both groups were held at the same frequency and same duration. And we measured frailty using the Fried phenotype. And we also included some secondary outcomes like physical performance, psychological well-being, and quality of life. The outcome measurement was carried out at 8-week and 16-week, and we analyzed data using the intention to treat principle. We found that both Qigong and light flexibility exercise group participants showed improvement in frailty score, and each representing a small clinically meaningful change. However, the magnitude of improvement in both groups did not differ. So the difference between the two groups was not statistically significant, and also similar for the secondary outcomes. Both groups had significant within group improvement in physical performance, psychological well-being, and quality of life, but the between group differences of the two groups were insignificant. I think both Qigong and light flexibility exercise can be recommended to the frail older cancer survivors, given their promising within group changes in frailty score. And of note, the improvement in frailty score represented a small clinically meaningful change for both groups. Also for the future research, I think we can adopt an inactive control condition in order to distinguish the treatment effect of Qigong or light flexibility exercise. Also, some research can be carried out to examine the underlying mechanisms that drive the change in frailty of the interventions.